just want to thank you guys for coming down to this medical awareness. I want to tell you guys about what my life was like before I went to China, and then afterwards when I came back. In the beginning, it was really hard because I couldn't see very well. I wasn't completely blind and I wasn't completely sighted. There was a lot of teasing that I had to go through, a lot of, you can't do this, and just stuff like that. Luckily, I had a very supportive family. I normally would read about 3 inches from my face. I'd use a telescope to see the board. And that was the daily life. And also the teasing was also part of a regular basis. And then after I got back from China, I was opened up to a whole new world. I started having improvements after the 3rd treatment. I realized instead of reading about 3 inches from my face, I could read 18 inches from my face. And that was a pretty cool story because I stumbled upon it and was not expecting anything. I just decided to write in a little journal and realized that I was writing about an arm's length away than when usually I'd be, right up to the paper. And I ran to my mom and I was like, Mom, you gotta see this, I think I'm seeing better. And she's like, not right now, Macy, not right now. I'm talking to family. And I was like, okay. And I thought I was just, maybe dreaming I was seeing something. And so I went back out and I sat back down again, started writing. I was like, okay, this is real. This is really real. Ran back inside. I had my mom write down on a piece of paper, just something. I think she wrote like, "You're the coolest school ever, Macy." And I read that from my little spiral notebook. And that right there was just amazing. And some of the things that I've been able to see now, I'm able to drive. I got my learner's permit, which is pretty amazing. And my vision right now is 20/80. And before it was 20/400 before I went for China. And yeah, I'm able to drive. I saw snowfall for the first time. I saw blades of grass. I saw a bunny out in the pasture while I was riding my horse. Just stuff like that. Being able to look into people's eyes and make that connection, whereas before I wasn't able to look somebody straight in the eye and see them and know what they were, make that connection like you do with the person that you're talking with. Stuff like that has just been amazing. It's a whole new world and I love it. Thank you all for letting me talk.
I really don't have much to follow with Macy. From a parent's perspective, it's a little different. There's a lot more emotions that you go through. And I've come a long way from being in a doctor's office with a 2-month-old with the doctor saying, your daughter's not going to see. And I asked her if he can give her my eyes, and he can't. It doesn't work that way. I feel like this has been an opportunity for Greg and I to give something to Macy that years ago we felt like we had no hope, we had nothing, and that we would just have to try to compensate for everything. And what this has done for us has been able to give our daughter, or help to give her, independence, which is something that means more to her right now as a 16-year-old than anything does.
Thank you for being here. It is an honor. Every time we have one of these meetings, the weather is always perfect, and I don't think that's an accident, that somebody's smiling down on us and encouraging us. I've met some of the bravest people I've ever met in my life, the parents, the children who have done this. I get calls all the time from other people who may be amenable to stem cell therapy, people with spinal cord injuries, people with Lou Gehrig's disease. My mother has a variety of Lou Gehrig's right now. When I first started, I just wanted to be helpful in any way I could. I've researched the science, I've looked at it. And when I met Macy yesterday, that was sort of life-changing because I couldn't believe how brave she was. And I had an opportunity to talk to somebody. A lot of the patients with ONH are very young, we can't speak to them yet. With Macy, I could see her medical records, I could examine the testing, and I could talk to her. I became even more convinced than ever that there is a lot to this. It needs to be researched and looked at very thoroughly here in this country. Right now, to the average American, stem cells are a political wedge issue. They don't really know much beyond that. But we know about embryonic, we know adult stem cells, And stem cells are used in the United States. Anybody with leukemia or multiple myeloma has been treated with stem cells. We know that we use amniotic tissue to treat anterior segment, front of the eye diseases. We'll use amniotic tissue and lay it on there in order to produce stem cells. Because when I cut into an eye to do surgery, it's the stem cells, as Dr. Hakim pointed out, that will heal that eye, that will heal that incision. The stem cells in the eye, in the adult, grow where the colored part meets the white part. So it's not as if they're unfamiliar in this country, but being used in a new manner. Americans are very jingoistic about medical care. We feel that if it didn't happen in the United States, it didn't happen. That's not always the case, though. But I think that I can play a role, I think, in some small way. I can look at these patients pre and post-op, and I can try and help bring this technology to the United States. We have very strict regulatory bodies in the United States. We have a very unforgiving legal system. But when something is right and something works, and I do believe it works, especially after examining some of the children who are here today, I feel this is proper to come forward and bring it to the United States. That is a very long and laborious process to bring some new technology like this to the United States. But once it catches fire, once it's recognized by medical schools and research institutes like Rockefeller or the one in La Jolla, Scripps, you might be surprised how fast it takes off. But Becky has been there all along for the last few years doing this. And when patients ask me, should I go to China? I say, for my child, yeah, I would go to China. That's what I would do. And I get called by other patients too, people with Lou Gehrig's disease, as I mentioned, and spinal cord injuries. And I say, yes, I think the science is there. People are very caring. It's a good facility, many facilities around the world. It's something I'm proud to say I'm part of. After 30 years of practice, it's nice to find a new challenge. But more than that, over the years, I can tell you as a physician, the hardest thing to tell somebody is, there's nothing we can do for you.
Do a speech today. Hello, my name is Jordan, and I am 11 years old. I have optic nerve hypoplasia. I live in Spring, Texas. I just had stem cell treatments done 5 months ago. But all in all, the treatments went perfectly fine. Before we left is when I started noticing the improvements.